I'm part of a big team at the university that work around the baby friendly standards. So I do have to give a huge acknowledgement as well to Sarah Johnson, who now leads on the baby friendly initiative at the University of Central Lancashire, because she's done a huge task, as Alison will know, of going through the reaccreditation for gold. And I know Alison's going to be talking a bit about that later. So that'll be really nice to hear your perspective as well, Alison. So yes, so welcome. And as Sue mentioned, I do work for a day a week at the moment on a secondment for the UNICEF Baby Friendly UK team. So it's kind of nice to have those two perspectives here with you today, just to be able to kind of talk about our experience as a university, but also to give you an overview today of what the gold standards are, what we're looking for, and also how you can embed that within your university. So for those of you that don't know, the UNICEF UK Baby Friendly Global Programme is based on child rights. So with the UN Convention of the Rights of the Child as the basis of all UNICEF's work. So the Baby Friendly Standards and the Baby Friendly Initiative came in around 1994. So it's been around for a while, and it's there to support families around feeding and developing close and loving relationships, and how we can get babies off to the very best start in life. The Baby Friendly Accreditation Programme is recognised, as you will know, more likely throughout numerous government and policy documents across the UK. So kind of to give you a context of the baby friendly standards as a whole, there's standards within maternity, health visiting, neonatals and children's centres. But we're here today to talk a little bit more about the university standards and what they actually involve. And we'll talk a little bit about the learning outcomes and what we're actually expecting of students if they're qualifying from a university that is baby friendly, what kind of knowledge and skills they will have to be able to bring to the world of midwifery and health visiting as well. So just to give you a little bit of an overview, here are the university learning outcomes, and I know that Alison will be talking to you about how you get these embedded across the course, but just to give you a little bit of context, the learning outcomes surround themselves around these 5 themes. So when we're thinking about understanding breastfeeding, what we're wanting to know is, do the students have the knowledge, the underpinning knowledge and skills to be able to support women with breastfeeding? And also the importance of human milk and the differences of human milk and formula milk also. We help them to understand how they can support infant feeding out in practice. So giving them the knowledge and skills to be able to support parents' decisions and choices around feeding. And also to understand the UK context that infant feeding sits within and the complexities that can come around that. And how do we support parents who formula feed to do so in a responsive and safe way as well? So I know Alison will be touching upon the WHO International Code and how we maintain that across the university as well. And we do incorporate that within the teaching across the curriculums as well. And when we're thinking about the support in the close and loving relationships, it's about understanding those secure mother and infant attachments and that knowledge of the attachment theory and how that relates to feeding, as well as those early relationships with parents and babies. Managing the challenges is covered within the university learning outcomes, as it's really important that students have the knowledge and skills to apply the anatomy and physiology of breastfeeding to how we overcome challenges that mothers may face. And also thinking about the wider social and cultural and political influences that can impact feeding and can sometimes undermine breastfeeding. And then really what underpins all these other themes is communication. And we are teaching this, and it's ingrained within our curriculums in university education around midwifery. But what is important is to have that positive communication when we're thinking about conversations around infant feeding. And also we'll really encourage how we can support students to go out there into practice feeling really knowledgeable and up to date with their skills and knowledge around infant feeding and how they can maintain that in time. So then what works? What works for students to be able to go out there into practice and have this underpinning knowledge and skills? So we know that having an evidence-based and up-to-date curriculum helps to prepare students for real-world practice. And what's really important in order for them to do that is to have the knowledge and skills and to have that portrayed by the lecturing team that they're being taught by, but also mentors, well, practice assessors and supervisors out in practice. So what we would encourage in relation to that is, how do we audit students' knowledge and skills, and how do we actually make a change based upon that audit? So how do we actually understand where the gaps might be? What things can we do to help to fill those gaps for students, and what things can we do to help build their knowledge and skills? But also having a really collaborative approach to having conversations around infant feeding, relationship building, having those collaborative links with our practice partners is so important to be able to maintain that consistent information for students to obtain, but also keeping that consistency for women and families. Thinking back to when I was just discussing about the different maternity services, thinking about children's centres, thinking about health visiting services, midwifery services. How can we ensure that that woman's journey is consistent in the support and the guidance that she's getting in relation to infant feeding and relationship building? And also using that stakeholder input and feedback too. So how I know many universities have gone through programs at the moment where they've had the revalidation of the curriculum, and how involving stakeholders into those conversations is so important to ensure that the education we're providing for students is relevant to out there in real world practice, and what women's experiences are being influenced by. And also the implementation of the code as well. So how does that fit within the university setting? So we'll chat a little bit about that. So to give you a generalised overview of the Achieving Sustainability Standards, the three main factors to take into consideration is having a leadership team, so developing and supporting that leadership team, but also having a really clear monitoring process. So going back to what I mentioned about audits, and how do we keep on top of understanding where students' knowledges are and how we can support them to expand that, or are there any gaps in that knowledge that we can help to support with? And also thinking about progression. So taking it further than the learning outcomes to actually think about how can we make this become everybody's business within the university. So taking it that next step further. So thinking about other courses, for example, that might be relevant, thinking about other aspects of infant feeding and relationship building across the university. So I think it's important, therefore, to kind of think about how we embed that change. How do we create changes within the universities to help to align to this? And just to give a bit more of an overview around leadership. So what is meant by that? What would be expected if a university was looking to go for the gold standard and the sustainability standards? It'd be an expectation to see that there is a baby-friendly lead within the university that has sufficient hours and support to undertake that role in an effective way, ensuring that that person who leads on this, it has the education and support behind them. And also that all of the lecturers that are teaching student midwives have the education themselves to deliver the baby-friendly learning outcomes. So that's about that whole team approach, thinking back to that consistency. But also having a baby-friendly guardian is so important, and I'll talk a little bit about that on the next slide. And also, how do we evidence that leadership team's education and engagement? So are we keeping our own staff at the university, up to date with changes, with new information that's come out, new evidence, new research around infant feeding and relationships? So then thinking about monitoring, so how do we maintain that? So as we mentioned, audits is such an important part of that, but also thinking about other elements of monitoring students' knowledge and any further support that they might need. So that could be through assessments, for example, aligning the curriculum, and also thinking about what teaching plans are in place for those sessions. And is there any other ways that you can actually help to get that information across for students? And also it's about having a really clear, effective internal and external reporting system. So actually, if if a university is noticing there may be a gap in practice or vice versa, that we're able to have that reporting system. And I think that coincides with what we said about working together. And then progression is that final step, really. So enhancing that teaching, thinking about the wider context and what other learning and assessment related baby-friendly learning outcomes we can think about. So thinking again about maybe potentially other courses. And I know Alison will talk a bit about this, but how do we actually improve experiences for students and staff? that may be feeding as well. So thinking about their journey, thinking about what can we do for them. I think when we totted up the population of students and staff in a university, it comes into thousands and thousands, and actually you're a mini community in yourself, and how can you actually make those experiences better for those that are working and studying within the organisation as well. So a little bit about the Guardian. For those that are looking to go for a gold award at the university, it's this person is such an influential part of that journey, and it needs to be somebody that is a high level member of staff, somebody that can have that wider context of the university, but also can advocate at that senior level to ensure that the baby friendly standards remain on the agenda. And thinking about that wider understanding of the baby friendly and the code as well. So this might mean maybe training your senior leaders within the university around the baby friendly standards and the code. And also they can be sensitive to any opportunities and threats. So if they've got that wider view, that helicopter view of the university, they're more likely to be able to pick up on any opportunities that might arise. And they're the ones that are able to provide that support that's needed for the leadership team for the baby friendly. So then what that looks like, for the Achieving Sustainability Assessment, these are the elements that will be looked at. So what education's in place for the lecturers and the leadership team? Is there a structure and support system? We'll have an overview of what the Guardian says about their role and what influence they have, in addition to any audit results and any sample assessments that might be in place for students. In addition to that as well, they'll want to see some action plans. So what's the plans for the future? What things are you already acting upon? What might have happened in the past that's changed? And just looking at if there's any improvements that have happened in relation to the learning outcomes, and anything that's happening across the wider university as well. So any innovative change that's happening. And as part of that assessment process, there'll be interviews with the head of department, the leadership team, so that will include the BFI lead for the university, any lecturers that are involved with teaching around breastfeeding, relationship building, and any other lecturers across the university that are involved too. And obviously the Guardian will be part of that process. So just to give you a visualization of what that looks like, once a university achieves accreditation for the baby friendly standards, they'll go for a reassessment. So at that reassessment point, which usually falls around 3 years, around about that, after that first assessment, they'll have a reassessment. Now, what that reassessment will tell us is whether a university is ready to move on to that achieving sustainability. And universities find that if they are aiming for achieving sustainability, they will aim for that as part of their reassessment, so that hopefully they can move on to the achieving sustainability within a shorter period of time. But as long as that achieving sustainability is within 2 years of the reassessment, then a university can go for that. Now, if the reassessment initially brought that there was some recommendations, some need for some amendments, some adjustments within the courses or within the teaching, for example, then there'll be a bespoke reassessment. So there'll be another quick maybe touch-based reassessment, and then hopefully aim towards the achieving sustainability. And what we would encourage, if a university needs maybe a significant amount of work, they might need to work on that to then go for the reassessment, to then move back into the cycle to go for the achieving sustainability. So once a university achieves the gold, then it moves on to a process of progression. So where do we go after that point? And Alison will be talking about this as well. And as I mentioned, Sarah's done an amazing amount of work at our university in relation to this. But you then move into that revalidation process. So the revalidation usually happens after around 12 months, and just a very brief assessment to see how you're maintaining that sustainability standard. And there's an annual license fee. So rather than having reassessments every 3 years, This is more of a maintenance, so it's keeping up and progressing things throughout the years. And what's really exciting about this is it gives a really good opportunity for innovation. So rather than working towards assessments year on year, what you're actually doing is really pushing the boundaries and building upon standards whilst maintaining the basic level throughout. So thinking about how can you involve other staff within the university? Is there any interprofessional working that would work really well? For example, School of Medicine working with student midwives around breastfeeding, relationship building. Other things that you could think about is how you support your own staff and students. So when they're returning to study or work and they may be feeding or bringing babies onto campus, what things have we got in place to support them? And also having links with practice. Is there any exciting opportunities that students can be involved in? Things like student champions, taking forward different and innovative, can't think.
Practice.
Yeah, absolutely. And then also, what things can we do to ensure that students that go out there qualified with that employability skill? They're coming from a university that's got gold accreditation, gold reaccreditation. So that can be a real help for students moving into the world of work as well. And also thinking about wider context, university context, thinking of things such as Athena Swan, how do we support women in the workplace? These are all really key progression topics that you could look towards once you're on that journey of achieving sustainability. And a lot of it is around making infant feeding everybody's business. So it becomes wider than just the midwifery programme. It becomes the university-wide topic of conversation, and that's really key. So this slide just represents some of the success stories around the Gold University standards. And I know this is building month on month with other universities going through this process. So it's a really exciting time. And I'm sure Alison will talk to you a little bit more about their journey too. And if you want any more information around the Gold Sustainability Standards for universities, I really, really encourage you to become part of the National Infant Feeding Network. So if you are a university lecturer that takes a lead with BFI, being part of the university network is influential. And I'm sure Alison will say the same, that for us on our journey in 2016, 17, leading up to our accreditation in 2018, this support network was invaluable in really giving you that support system, other people to bounce ideas off, other people that have gone through the process that can really help to guide you with it. And any queries can always be sent to the BFI inquiries, and there's quite a lot of information on the UNICEF Baby Friendly website as well around the standards. And also being involved in the conference is an amazing way of seeing the up-to-date kind of research around the baby friendly standards. And it's also just really great to be involved. It's a really nice way of bringing the team together. So this year the conference is on as a virtual conference this year on the 23rd and 24th of November. So that's everything from me. But I would be really happy to answer any questions at the end, if anybody's got any questions at all for me. Thank you so much.